Welcome back. This presentation is on menstrual cycle. At the outset, let us be aware of the learning goals. 1. State some of the typical characteristics of menstrual cycle. 2. Analyze the complex interaction of hormones in menstrual cycle. 3. Explain the 3 phases of menstrual cycle. 4. Discuss some strategies to cope with premenstrual syndrome. 5. Identify the fertile window within a menstrual cycle. And 6. Deduce some of the practices related to menstrual hygiene. Most of us think of menstrual cycle as menstruation or period. Well, menstrual cycle is more than just the period or menstruation. In fact, the period or menstruation is just the first phase of the menstrual cycle. So, what exactly is a menstrual cycle? Menstrual cycle is the series of cyclic changes that occur in the female reproductive system to prepare a female's body for pregnancy. The exact timing of the cycle is a little different for every woman and can also change over time. About once a month, the uterus grows a new lining of endometrium to get ready for a fertilized egg, and at the same time, the follicles in the ovaries are to develop and mature in order to release an egg for fertilization. Menstrual cycle is actually made up of 2 cycles that interact and overlap with each other, one happening in the ovaries and the other one in the uterus. The average age of onset of the first menstrual cycle is about 12 years, but it can range anywhere from 10 to 15 years in girls. The onset of the first menstruation or period in a girl is technically called as menarche. And understanding the changes in the female's body during the menstrual cycle can go a long way in helping us enjoy a healthy reproductive health, growth, and taking good care of ourselves and developing a mutual feeling of respect, trust, and safety. And I believe through education, we can overcome the taboos and false beliefs associated with menstruation. Menarche is an important biological milestone in a woman's life as it marks the onset of the reproductive phase of her life. But unfortunately, due to lack of knowledge, there is still an element of shame associated with a woman's monthly cycle around the world. And this leads to women suffering in silence. So for all of this to change, men too need to be more open and empathetic so that the feelings of shame and mistreatments are being removed and a healthy, open community is established. Menstrual cycle reoccur approximately every 28 days in a female, but it's normal to have a slightly shorter cycle or a longer cycle. Younger adolescent cycle can range from 21 to 45 days, while it can range from 21 to 35 days in adult females. Now, to figure out how long your menstrual cycle is, start by counting from the first day of your menstruation or period up to the first day of your next period. And it is common and absolutely normal for your menstrual cycle to be somewhat irregular for a few years after menarche. As you progress through adolescence, menstrual cycle become more regular. And the length of the menstrual cycle is determined by several factors such as our age, genes, health, our weight, our lifestyle, and even by some birth controls. So, how does a menstrual cycle work, or what controls the menstrual cycle? Menstrual cycle is controlled by a complex interplay of hormones from the brain and ovaries. Hormones produced from the 2 structures in the brain, namely the hypothalamus, which produces GnRH, and pituitary gland, which produces FSH and LH, communicates with the ovaries through the blood. And the ovaries then produces its own hormones, that is estrogen and progesterone, which stimulates the uterine lining as well as the other reproductive structures in the females, and thus keeps the menstrual cycle going. Menstrual cycle can be described by the ovarian or uterine cycle. The ovarian cycle describes changes that occur in the follicles of the ovary, whereas the uterine cycle describes changes in the endometrium lining of the uterus. And both of these cycles interact and overlap with each other and can be divided into 3 phases. 1. Follicular or proliferative phase. 2. Ovulatory phase. And 3. Luteal or secretory phase. Let us now look at some details. Follicular phase occurs from approximately day 1 to day 13 of the menstrual cycle. As the secretion of FSH increases slowly during the early days of the menstrual cycle, it stimulates the growth of several primary follicles containing primary oocyte in the ovaries. More and more of the follicular cells are formed around the primary oocyte, and the follicles are then to be growing and maturing to form secondary and tertiary follicles. Surprisingly, only one follicle which has the dominant oocyte matures into a Graafian follicle, and these follicular cells are going to be producing estrogen, which lowers the levels of FSH and stimulates the secretion of LH from the pituitary. At about 14th day of the cycle, the level of the LH surges sharply, which induces the completion of the meiosis 1 in the primary oocyte somewhere about 10 to 12 hours after LH surge. And as the follicles are developing in the ovaries, the old unused endometrium lining of the uterus are shed out through the vagina along with the blood as menstruation. And after about a week, new endometrium linings are being regenerated in the uterus. So, menstruation is caused by the low levels of estrogen and progesterone during the beginning of the menstrual cycle. And menstruation is also an indicator that a female has not become pregnant. And there would be the shedding down or breaking down of the unused endometrium of the previous cycle along with the blood vessels, and they are going to be coming out in the form of blood through the vagina. And during each menstruation, the average blood loss would be somewhere around 10 to 80 ml of blood, and the length of the menstruation can be lasting for 3 to 7 days. And just before a week or so, a woman can experience premenstrual syndrome or PMS. Premenstrual syndrome is a very common condition that affects women in terms of her emotions, physical health, and behavior. PMS has a wide variety of signs and symptoms, including menstrual cramps, headaches, acne, mood swings or irritability, breast tenderness, bloating, fatigue, food cravings, and it can also lead to depression. Some women get their periods without any signs of PMS, or some has only very mild symptoms of PMS. But for others, PMS symptoms may be so severe that it makes it hard for her to go about with her normal everyday activities. Severe PMS may need medical help and consultation with a doctor. And researchers speculate that changes in the hormonal levels during the menstrual cycle might be affecting more in certain females than in the other females. And PMS symptoms may get worse as the woman transitions into menopause. Now, how to deal with PMS? Well, these activities may help us to keep ourselves healthier in general and may also relieve some of our PMS symptoms. Getting enough sleep, doing regular exercises including aerobic activities, stretching and yoga, choosing healthy, low-fat vegetarian diet, which includes lots of green vegetables and fruits and less of salt, caffeine and sugar. Taking certain dietary supplements such as calcium, magnesium and vitamin B6 supplements may also help to relieve some PMS symptoms. But you must remember to consult a doctor before you are taking any of these supplements. And finally, not to forget of our age-old basic hot water therapy. A hot compress can shed the body's pain receptors and relieve us from the pain without having to take any painkillers. And I guess if menstrual pain can be relieved without having to take chemical drugs, it would be one of the most preferred option for us. And I recommend you all to check if the hot water bag therapy works for you. Personally, hot bags have been a savior for me during my menstrual cramps. Well, the second phase in the menstrual cycle is the ovulatory phase, which begins when the levels of LH surges at about day 14th of the cycle. LH surge causes rupturing of the mature Graafian follicle and releases the secondary oocyte, which is then sucked up by the fimbriae into the fallopian tube. Now, which ovary out of the two ovaries can ovulate in each month? Now, there isn't a single straightforward answer to this. There seems to be multiple anatomical and physiological factors that regulate or that influence the ovulation pattern. Ovulation occurring alternately from one ovary to the other ovary in 2 consecutive cycles has been shown to be greater in younger women than in older women. Likewise, interestingly, it has been demonstrated by various studies that the right-sided ovulation favors pregnancy more than the left-sided ovulation. And another big area of interest and concern is when can a woman be likely to conceive or become pregnant? As we know, egg and sperms only live for a short period of time. Egg can only be fertilized for around 24 hours after being released from the ovary, and the sperms can live for around 3 to 4 days. Hence, it is absolutely important for the egg and the sperm to meet at the right time for fertilization to happen. The days in a woman's menstrual cycle when pregnancy is possible is called as the fertile days or fertile window, and fertile window are the days around the ovulation. Typically, fertile window have been clinically identified between days 10 to 17 within a typical 28-day menstrual cycle. Having intercourse or sex during this window is considered to be one of the best chances for getting pregnant. However, in only 30% of women is the fertile window entirely within the days as per the guidelines. Most women reach fertile window either earlier or much later. And it's therefore advised that the timing of our fertile window can be highly unpredictable, and it is all the more unreliable if you plan to be avoiding pregnancy by this method. Rather, contraception would be the best option if pregnancy is to be avoided. The third or the final stage in menstrual cycle is the luteal or secretory phase. During this phase, the ruptured Graafian follicle closes to form corpus luteum, and corpus luteums are going to be producing high amounts of progesterone, which maintains the endometrium lining in the uterus. On fertilization of the egg, the embryo gets implanted to the uterus and secretes a hormone called as human chorionic gonadotropin hormone, which is abbreviated as HCG. And human chorionic gonadotropin helps to maintain corpus luteum, and thereby corpus luteum continues producing progesterone. Now, you might be aware of the pregnancy test kit. It has something like a dipstick on which the urine is tested. The kit can detect HCG in the urine about a week after you have missed your period. So HCG is a hormone which is present only in a pregnant female. Well, as you can see here in the figure, the red lining in the uterus represents endometrium. The lining of the endometrium remains thick in the presence of corpus luteum in the ovaries, and the corpus luteum can remain intact only if the egg gets fertilized by a sperm. Now, if the egg is not fertilized, or if the fertilized egg fails to implant or attach to the uterus, then the corpus luteum degenerates after about 14 days of its formation. And this results in the drop in the level of estrogen and progesterone, thereby preparing the female for the next cycle or for the next menstruation. Just as changes occur in the ovaries, the luteal phase overlaps with the secretory phase of the uterus. The lining of the endometrium secretes various chemicals that will either support embryo development or help in the shedding down of the endometrium tissue. For instance, uterine milk is a secretion which nurtures the embryo if it gets implanted onto the uterus. While on the contrary, prostaglandins are other types of secretions which promotes uterine contractions during menstrual bleeding. Well, the complex signals from the pituitary hormones in the form of FSH and LH during the menstrual cycle regulates the changes inside the ovarian follicles and the uterine endometrium, which continues repeatedly in a female from the menarche to menopause. And menstrual cycle can only be disrupted during pregnancy. Finally, I would like to emphasize the need and importance of menstrual hygiene. You must be all aware that a day has been dedicated in order to celebrate menstrual hygiene across the world. Yes, you are right. It falls on May 28th. And I'm not sure if you know the reason why this particular month and day has been chosen for the menstrual hygiene. I appreciate if you know it already, or I'll appreciate if you find out the reason by yourself if you don't know. Anyways, this day is dedicated to empower women from all the challenges associated with menstrual cycle, menstruation and menstrual hygiene. As responsible and educated members of our community, we must remove the persisting social taboos, avail access to hygienic menstrual products, and remove ignorance and fears that is there in ourselves and in others regarding menstruation. And here are some of the tips that each one of us can easily practice in our life and also empower others on menstrual hygiene. 1. We need to change our sanitary pads regularly after every 4 to 5 hours of usage. And if this is not done, it can lead to complications such as the toxic shock syndrome, reproductive tract infections, and it can even cause other vaginal diseases. Secondly, if you are using reusable pads or menstrual cups, it must be washed, dried and stored properly for future usage. Now, washing hands is the most simplest practice of keeping ourselves away from many infections, including the reproductive tract infections and also COVID-19. And we must wash our vaginal area with water at least twice a day in order to get rid of the harmful bacteria. And most importantly, it must be done in the right way. When I say right way, it has to be washed from the front region, that is from the vagina, to the back region, that is the anus, and never the other way around, as it might be causing some of the harmful bacteria from the anus to enter into the vagina. So the next important practice is to discard the used pads or tampons properly by wrapping them in paper and throwing into the designated bins. And this should be stopping the spread of bacteria and infection. And we must never ever flush the soiled pads or tampons down into the toilet. We don't want to be choking our toilets. And it's highly recommended that you change your undergarments every day. The washed undergarments are to be dried properly under bright sunlight. And I would say there's no need to be hiding the panties in some corners of the room. Rather, we have to dry them in bright sunlight so that it gets the benefit of disinfectant from the natural sunlight source. And do not forget to carry some extra pads in your backpack while you're on the go. So these are some of the easy and effective practices for your good menstrual hygiene and reproductive health. Please feel free to talk to me for any of your concerns, or you're welcome to share any ideas or action to empower and help each other. So keep growing, and I'll see you in the next one.